And that is so that we can share the recording of the training with participants who were not able to join us today. We do ask that you put your name and your organization in the chat box. And if you did not register with us, if you found us through another way, if you want to stick your email in there as well, we will be sending a follow-up email to this presentation today where we will share the recording, the presentation slides, answer any questions we couldn't get to, and have we'll provide you with other follow-up resources as well in that email. So if you are interested, just put your email in the chat box as well. And with all of that, I think we are ready to get going with the program. So I'm going to turn it over to Susan Kornecki. Take it away, Susan.
Thank you, Elizabeth, and good morning, everyone. It's so nice to see you all today. I just want to check, can folks hear me and see the slides? Would someone mind giving me a thumbs up? Looks like I'm good. Thank you so much. All right, so good morning, everybody, and welcome to our overview of food security resources in Montgomery County, Maryland. I'm looking forward to giving you an overview of some history that has led to the work that we will share with you today. First, as we jump in, I wanted to share a brief background on the Montgomery County Food Council. So we are a food policy council, and our goal is to create a sustainable, equitable, just local food system in Montgomery County, Maryland. And we envision a food system where we have policies and programs in place that can support everyone in Montgomery County in achieving short-term and long-term health in a way that supports our local environment and our local economy as well. So just a little bit of background on our organization. And now I'd like to share with you a little bit of history about the Food Security Plan, which outlined a few specific recommendations and paths forward that led to some of the programs that you'll be hearing about this morning. So for those of you who may not have heard of this document before or may not be familiar with it, Montgomery County has a food security plan that is one of the first produced by a collaboration between a government entity and a nonprofit organization in the nation. So it has been held up as an example for other municipalities throughout America, which we find very exciting. The plan, A Food Secure Montgomery, What We Know Now and What We Can Do, was developed as a result of a bill that was passed in 2016, where Montgomery County Council stated that it would be required that Montgomery County government and nonprofit partners develop a 5-year strategic plan to reduce food insecurity in Montgomery County, Maryland. The plan needed to be delivered by December 2016. So throughout 2016, dozens of listening sessions and community meetings were held with stakeholders from all across the food system. Certainly folks who are working to reduce nutrition insecurity and food insecurity through food bank work and other anti-hunger efforts, but also nutrition educators, teachers, parents, community organizers, social justice organizers all came together and started to articulate a vision for what a more food secure Montgomery County could look like. During plan development in the fall of 2016, statisticians within Montgomery County government and public health professionals also brought together a lot of different data sets that helped inform priorities that were identified in this strategic plan. The plan was released in early 2017 by then County Executive Ike Leggett, and it outlines specific recommendations for each of the 5 years following the release of the plan. So January 2017 to present has been the years of implementation of this plan. And within the last year and a half, our COVID-19 response to rising food insecurity, which in many ways was also steered by specific recommendations of this plan. One tool that arose as a result of all those data sets being gathered together is Foodstat, a statistical tool developed by Montgomery County government and housed within the statistician wing within the county executive's office, I believe. And this is a new tool that brought together several different layers of data sets to try to determine hotspots or areas where food insecurity was a bit higher and where residents were probably at increased risk for food insecurity. So this layer here shows you an overlap of several types of data that were combined to try to understand where food insecurity might be highest. As I'm sure many of you know, it is an interconnected, complicated public health challenge that is often the result of several different vulnerabilities or challenges that an individual Montgomery County resident or a community may be experiencing. So to try to consider all of those interconnected challenges, the statisticians who put together these data sets looked at poverty rates, enrollment in the free and reduced meals program or FARMS, access to public transportation, enrollment in the SNAP program, family income and individual income, and other layers to try to layer them together and look at areas where there might be some increased food insecurity. I want to note that this map was produced in 2017, so the data has shifted and changed. So we are working actively to make sure to create more up-to-date information on the state of food insecurity right now, and I'll have a little bit more on that in a moment. As we look at this map, I also just wanted to share big picture that when the Montgomery County Food Council and Montgomery County Department of Health and Human Services developed the food security plan, the estimate at that time was that about 60,000 Montgomery County residents were experiencing food insecurity or at risk for food insecurity. Our current estimates are that that number is probably close to 100,000, and that's based on unemployment rates and other statistics that we have access to right now. But that is an estimate that about 100,000 Montgomery County residents are at risk for or experiencing food insecurity at this time. I want to elevate a couple findings that the food security plan illuminated, and this is as a result of those listening sessions and community meetings, as well as the analysis of various types of public health data and information that was looked at throughout the development of the food security plan. These are populations that were found to very frequently be at risk for food insecurity: children, seniors, folks living with disabilities, whether that be a mental or physical disability, foreign-born residents, and then residents experiencing other factors or experiencing more than one of these risk factors. I see folks on the line who are already actively engaged in programs that are trying to reduce hunger among kids. So I know that this may be a population many of you are already thinking about, but I just wanted to share that the data revealed that children who were perhaps already experiencing insufficient food at home were at increased risk for food insecurity and for immediate hunger on the weekends and over the summer. And then there was also an increased risk in children living in single parent households and among children of color. And as I'm sure many of you know, children who are experiencing food insecurity can have poor health outcomes, both short-term and long-term, and sometimes can present with higher rates of behavioral issues and social challenges as well. So just some of the reasons why they were identified as a priority population as this food security plan was developed. At least 6.6% of seniors in Montgomery County in 2017 are estimated to be living below the poverty level, with almost 30,000 of those Montgomery County residents living below the self-sufficiency standard. So as I'm sure everyone on this call is very well aware, the cost of living in Montgomery County is significantly higher than most of the surrounding municipalities, and it's definitely higher than the national average. So the self-sufficiency standard is an estimate for the amount of yearly income that is necessary to support a family of four and just have basic needs met. Based on numbers in 2017, that was about $90,000 for a family of four. It has certainly gone up as the cost of living and other day-to-day costs have gone up as well. So a significant number of seniors, at least 30,000 folks, were living below the self-sufficiency standard. So probably struggling to meet basic needs such as grocery bills, energy bills, and rent. The data also showed that it's not only residents who are experiencing physical disabilities or cognitive developmental challenges or delays, it's also families with a disabled family member who are estimated to be 2 to 3 times more likely to be food insecure than families that were not living with those circumstances. And working aged adults, so folks 18 and older with a disability, are twice as likely to live below the federal poverty level as adults living without disabilities. I mentioned foreign-born residents already, but I wanted to just regroup quickly on this one because it's a really large part of the Montgomery County population. And the data revealed that the folks who were born in other countries and moved to Montgomery County were in many cases experiencing one or more barriers to food access. These barriers included cultural or language barriers in terms of just accessing basic information about where to access food or how to access federal nutrition benefits programs. Lack of culturally appropriate food showed up in the data frequently and in the listening sessions as well. And we also saw some of these challenges and increased risk for food insecurity in families with mixed documentation status. And there are other challenges that the population can face as well, in terms of not knowing which benefits one has access to, and other concerns perhaps about sharing data or sharing information about other family members who may be going through our complicated immigration process in real time. And then finally, I just want to note the other factors bracket. It's a broad term, but a complicated and important piece of this. Many Montgomery County residents are eligible for federal nutrition programs, but not currently enrolled. We'll go more into eligibility and specific programs later, but I just wanted to highlight those folks who are below that self-sufficiency standard and probably qualify for the SNAP program or the WIC program and are not yet enrolled. That was seen as a population slipping through the cracks and at increased risk for food insecurity, as well as residents who may be working one or more jobs, folks living with dietary restrictions, and residents who may be experiencing transportation challenges, whether that be due to a lack of a vehicle, a physical disability, or managing other logistics, or simply living in a community with limited or no public transportation access. So I mentioned that we're working on updating the data. I wanted to share just briefly that in January through March of 2021, the Montgomery County Food Council, in partnership with Montgomery County DHHS and the Montgomery County Food Security Task Force and an evaluation firm called Community Science, we issued a community food access survey. The goal for this survey was to get a better understanding and a more up-to-date understanding of food access challenges that residents were experiencing and perceptions of food access and resources that were available so that we could get better information about how to get information out more effectively into the community about the many resources that are available. The survey was developed in English, Spanish, Amharic, French, and Mandarin. And we received over 2,580 responses throughout this digital survey conducted over 3 months. A couple of findings I wanted to highlight real quick before we move forward into some specific programs that are here to help these populations right now. Spanish language respondents indicated more concern about running out of food before the pandemic than the English language respondents. They were asked to rank their concern before and during. They noted that increase in concern, both populations did, but the Spanish respondents noted overall had a much higher increase in concern. Across all regions, we did see an increase in concern about food insecurity. Generally speaking, in mid-county, so in the Wheaton area and surrounding zip codes, we saw the greatest level of concern before and since COVID-19. And folks living in the Bethesda area reported the least increase in relative concern. One of the takeaways from the evaluation firm that was offered back to the Food Council, and we'll share this in a summary report soon, is that food assistance resources and programs provide crucial support for residents all throughout the county, in particular for Spanish-speaking residents. And there is a need for a deeper understanding of the food security needs and challenges across racial and ethnic groups, and the factors underlying perceptions of the availability, accessibility, and the acceptability of food assistance resources. Two concerns that came up, just to add a little bit of explanation to that, is residents expressed concern about contracting COVID-19 when accessing food assistance resources. This was before the vaccine rollout, but I still think it's an important data point to share with you all. Concern about public health safety when accessing food assistance resources or going to a specific site. And there was also concern that showed up consistently in the data that other people need these resources more than I do, so that it presents opportunities to share information about how much is available and what kind of help folks can get when they visit a food assistance site. And finally, I just want to mention that in addition to surveying specific residents, the Montgomery County Food Council, working closely with the Food Security Task Force, has also been hosting listening sessions to talk with food assistance providers and ask for feedback about what a recovery position and our moving forward out of emergency response should look like as part of the years 4 and 5 recommendation in the food security plan that we transition into a more resilient food system where folks are empowered through food literacy, workforce and economic development programs, and are developing plans for a food system that is really resilient and is better prepared for shocks to our food system. So throughout our listening sessions, we've been hearing a couple things. We've been hearing pretty consistently that demand for services is about the same. So while the state of Maryland is no longer in a state of emergency, well, officially in a policy context, we're out of our emergency response phase. What we are hearing from food assistance providers is that the need is still there and residents are still in need of food, in many cases at the same numbers that were seen during the first year of COVID-19 response, at the same numbers, or in some cases, slightly increasing. A few providers have reported a decrease in need. I want to note that as well. And they are establishing partnerships and referral platforms to support the residents they're speaking with and to try to make sure that folks are getting connected with resources as much as possible. We received positive feedback on the Farm to Food Bank program, which was a program through CARES Act dollars to provide grants to farms so they can sell food to food banks at a cost point that works well for the farms and gets more fresh local produce into the food assistance system. Lots of positive feedback on that. And we heard from some organizations that they're reflecting on their operations and considering a shift toward more choice pantry style options as we move out of the first phase of emergency response. Looking ahead, these are some pieces the Food Council is thinking about to create more resilient opportunities. We need better economic opportunities throughout the food system. We need more and better supports for businesses that are trying to grow, particularly businesses run by communities that have historically been marginalized in multiple systems throughout our region and our country. We need to improve land access and move toward creating and producing more local food. And again, be prepared for shocks and supply chain disruptions in the future. And so with that, I'm going to introduce my colleagues, Allison Schnitzer and Cynthia Cuestas, who are going to take us through federal nutrition assistance programs. Over to you all. Thank you.
Hi, good morning, everyone. My name is Allison Schnitzer. I am the Food Access Initiatives Manager at the Montgomery County Food Council. It's nice to see you all here today. As Susan said, we're going to start talking now about the federal nutrition assistance programs that are available to Montgomery County residents. Next slide, please, Susan. So here's an overview of the USDA nutrition assistance programs. I'm going to be talking about SNAP, and then my colleague Cynthia will be talking about WIC, and then a little bit later on, our colleague Emery will be talking about the child nutrition programs. Next slide, please. So just some basics about SNAP. It's formerly known as food stamps, and here in Maryland it was known as the Food Supplement Program. It is the largest federal nutrition assistance program, and you can see from the amount of money spent on it, one, that it is the largest, and also you can see the pre-pandemic versus pandemic cost of it, and just how much the pandemic really raised the need for SNAP in our country, and how much our country really relied on SNAP. SNAP is really considered to be the nation's most important anti-hunger program because it is the first line of defense against hunger. Nearly half of those who receive SNAP benefits are children. And SNAP is an entitlement program. So if you are eligible, you will receive benefits. It's a common myth that some people don't want to sign up for SNAP because they think they will be taking benefits away from someone else, but they will not. There will always be money allocated for those who are eligible for SNAP. To apply for SNAP, you must apply in the state in which you currently live. Right now in Montgomery County, there are about 76,000 residents who are receiving SNAP benefits, and that's a significant increase from an average of 55,000 pre-pandemic. But as Susan alluded to earlier on in the presentation, Montgomery County has the highest SNAP gap in Maryland. The SNAP gap is the difference between residents who are eligible for SNAP and those who are actually enrolled. So the work of the Food Council and others who are engaged in this work is to try to close that SNAP gap. Next slide, please. Okay, so eligibility for SNAP, I know that this is a commonly confusing subject. Essentially, to be eligible for SNAP, and this is if you are not a US citizen, you need to have lawful permanent resident status for 5 years, or you can have that status for any period of time if you also have a disability. People who are refugees or asylum seekers, they are also eligible for SNAP. And children under 18, regardless of their parents' citizenship status, are eligible. So if heads of household want to apply for SNAP and they're worried about needing to put in their information or their social security number or anything like that into the application, they do not need a social security number to apply for SNAP benefits for their household. The application will be looked at for those members of the household that are eligible, and they don't need to put in their own information. And then in terms of college students are eligible if they are only part-time students and work 20 hours a week, or if they have a child who is under 6. People who are not eligible for SNAP, full-time college students are not eligible, though there is a waiver for that currently during the pandemic. So those college students who would qualify for work study and whose families are, have an expected contribution of $0 can get SNAP currently. But if you are foreign born with a work visa, or you don't meet any of the other above criteria, you are not eligible for SNAP. Next slide, please. The way that benefits are determined for SNAP, it's really based on 3 things. It's based on household size, income, and expenses. The household is really considered the people who buy and prepare food together. So that can be parents and children, it can be married couples or couples living together, it can even be roommates. And if you are 60 or older, even if you live together, you can still apply separately. But that's the only special situation in which you can apply separately. Otherwise, you apply as a household. Income is determined based on the household income, whether it's earned or unearned. So that would include, wages or salaries, tips, any sort of benefit income that would come in, like unemployment, disability, temporary cash assistance, any sort of child support or alimony, that all counts as income. But things like stimulus checks and loans and your assets, they do not count as income. And then your expenses are then deducted from the income to determine if you are eligible. And expenses include things like rent and mortgage, any property tax, any home or renter's insurance, any court-ordered child support or alimony, and then for seniors, any out-of-pocket medical expenses. And I included a link here to a pre-screener and benefits estimator for Maryland SNAP that residents can use to go in and have a sense if they might be eligible for SNAP. Though I do want to say that we encourage anyone who thinks that they might be eligible to apply, even if the pre-screener says that they may not be. Next slide, please. So if you do have SNAP benefits and you're able to get an EBT card, here are the foods that you can purchase with SNAP. You can purchase fresh fruits and vegetables, meats and poultry, dairy products, bread, cereals, non-alcoholic beverages, and then any seeds or plants which can then produce food. Things that cannot be purchased with SNAP are any sort of alcohol or tobacco, vitamins or supplements, and then unfortunately any sort of hot food, prepared food that you would buy at a grocery store, like a rotisserie chicken, is not a SNAP eligible food. Next slide, please. And then SNAP benefits can be used at any SNAP authorized retailer, and there are thousands and thousands of them. Obviously, the most common one is a grocery store, but you can also use your SNAP benefits at farmers markets, and there's a link there to the Montgomery County farmers markets, which will list not just the SNAP, the ones that accept SNAP, but the ones that accept a variety of nutrition programs. And then as of June 2020, people in Maryland can use their SNAP online, and they can use it at those 5 retailers. And then I also included a link to a retailer finder for SNAP authorized retailers. And then lastly, Maryland is now participating in the restaurant meals program. So for SNAP residents who are elderly or who have a disability or who are experiencing homelessness, they can go to a restaurant that is participating in this program and they can get a meal from that restaurant using their SNAP benefits. Next slide, please. So there's been a lot in the news recently about changes to SNAP benefits amounts. So we'll start with the good news, which is the Thrifty Food Plan update, which is really good news. Earlier in the summer, it was announced that the Thrifty Food Plan had been revised and updated. And this is the plan on which the SNAP benefit allotment is determined. So the Thrifty Food Plan was increased in its benefit amount. And so the average SNAP recipient will see a modest increase in their SNAP benefits due to this increase. The good news is that this is a permanent increase in SNAP benefits. This is not related to the pandemic at all. This is just an update to the plan that determines SNAP benefits, and SNAP recipients, they don't have to take any action to receive the increase. They will automatically receive it. Next slide. Then unfortunately, the bad news is that the emergency allotments for SNAP, which is have been going on during the pandemic, this was due to the state of emergency in Maryland. All SNAP recipients were receiving the maximum benefit. Starting October 1st, SNAP benefits will now just include their standard benefits. So whatever they are, whatever is determined for their household to receive is what they will go back to receiving, or if they were a new SNAP recipient during the pandemic, now their benefits will be calculated based on their household information, and they will not be given the maximum SNAP benefit anymore. So the minimum SNAP benefit per month is $20 a month, but for seniors in Maryland, it is $30 a month. There are a couple waivers that have been extended due to the pandemic. So the recertification, which is, SNAP recipients typically have a 6-month recertification period. So that right now, that waiver has been extended through the end of the year. There's also an interview requirement for a SNAP application. That waiver has also been extended through the end of the year. The able-bodied adult without disability job requirement. So if you are, they call them ABODs, if you are one of those, you have only 3 months of SNAP benefits until you are required to show some work or some work training. That is being waived through June 30th of 2022. Maryland residents on SNAP were sent information about the changes to emergency allotments via the mail. We've been hearing a lot of confusion and inquiries. So if you deal with any SNAP eligible populations, you may be hearing the same things as well. Our role is to educate and inform SNAP recipients about these changes. What we have heard is the most important thing that we can tell SNAP recipients is that they really need to confirm that their income and expenses are correct on the letters that they are receiving from Maryland DHS, and if not, to file a change. And I put information for the DHS call center there. They should not submit a new application because that will just stall their benefits even longer. Thanks, Susan. And then if you're looking for direct SNAP assistance in Montgomery County, there are several community-based organizations that are funded directly by the Maryland Department of Human Services. These organizations conduct SNAP outreach, they pre-screen residents for SNAP eligibility, and then they assist directly with the SNAP application recertification. I've listed them here with links to them, and I'm very excited to say that very soon, the Montgomery County Food Council will be one of these organizations that will be providing direct assistance to the SNAP eligible population in Montgomery County. And now I'm going to turn it over to Cynthia Cuestas, our wonderful Vista, to talk about WIC.
Hi guys, my name is Cynthia. I'll talk about WIC. So WIC stands for Supplemental Nutrition for Women, Infants, and Children. It's a federal program that provides supplemental nutritional foods and services to women, infants, and children who come from low-income households. Though WIC is federally funded, WIC is not an entitlement program. Congress authorizes funding for WIC each fiscal year through appropriations. Next slide. Thank you. So WIC recipients receive an electronic WIC card, not to be confused with the EBT card, to purchase specific and eligible foods at authorized grocery stores and farmers markets. Eligible foods will have a WIC approved sign next to it. To find WIC approved retailers, you can use this link, which I will share in the chat box for WIC approved retailers. There you go. And eligible foods to purchase are to be nutritional for women, infants, and children, such as formula and baby cereal, cheese and milk, whole wheat bread and brown rice, other fruits, vegetables, and canned fish. WIC also offers various health services, and one of the popular ones is breastfeeding support. Recipients receive one-on-one counseling from breastfeeding experts. Recipients also are eligible for breast pumps and other supplies. Next slide, thank you. So women and children are eligible for WIC, specifically women who are pregnant, postpartum, and are breastfeeding, infants and children up to their 5th birthday. Non-US citizens are also eligible for WIC. Other requirements such as income, generally applicants who make below a certain income level of their state are eligible for WIC, and applicants must do a nutrition screening or assessment, which is conducted during the WIC application appointment. To see if you are eligible for WIC, you can use this pre-screening tool, which I will also share in the chat box. Next slide, thank you. Okay, so to apply for WIC, schedule an appointment with the Montgomery County WIC office. You can also call the main hotline to schedule an appointment, and there are other offices in Montgomery County you can contact, which I will also share in the chat box. Due to the COVID-19 pandemic, most WIC clinics are closed, so your interview may be conducted over the phone. Right. And so you will need to bring the following documents for each person applying with your appointment. Sorry, it was the previous slide, Susan. Sorry, thank you. So these documents will prove identity, address, income, and pregnancy if pregnant. So next slide, thank you. Okay. During your appointment, staff will check eligibility by reviewing your documents and perform a health screening. The screening includes checking weight, height, and a finger stick blood test. Staff will also discuss nutritional needs and concerns. If found eligible, an electronic WIC card and a list of WIC approved foods for the household will be issued. WIC will also share referrals for other services if needed. Remember, WIC can only provide supplemental food. You will need to buy more food than WIC provides. I will also share in the chat box additional resources regarding WIC. And I do see questions coming in the chat box. I will read them right after this and get back to you all. So on another note, Montgomery County Food Council is we are recruiting for our 22 Cohort Food Security Community Advisory Board. The board is comprised of county residents who have experienced or are currently experiencing food insecurity. The board meets 4 times a year to advise the Food Council and its partners on the implementation of the county's food security plan by sharing their experiences, thoughts, and perspectives. If you know anybody who might be interested, feel free to circulate the application, which I'll also share in the chat box, and my contact information. Thank you. And I'll pass it off to Anne-Marie.
Thank you so much, Cynthia. So Allison and Cynthia provided a great overview of programs available at the federal level, and I'm going to talk now about how some of those programs are carried out locally, as well as what food assistance resources are available at the county level. So first, let's look at those that focus on special populations, and here are the ones for children. As Allison mentioned, there are all the child nutrition programs provided for at the federal level. So those include things like school lunch, breakfast, summer feeding, the fresh fruits and vegetables program, which are delivered locally through Montgomery County Public Schools. And I see that many of you here today are from linkages offices or parent community coordinators, so you're probably very familiar with this. Families can apply to receive free and reduced price meals, also known as farms, and may qualify based on household size and income. Families receiving food supplement program or temporary cash assistance are also considered, and families can apply online in a number of different languages. Due to COVID, this year things are a little different. Free meals are provided to all students on instructional days this school year, with free snacks and supper also available to take home. Schools are also making arrangements for meals to be sent home with students who have to quarantine due to either a potential COVID diagnosis or COVID exposure. There are also federal meals programs that benefit seniors called the Senior Nutrition Program, available to county residents age 60 and older for a voluntary donation and for their spouses of any age, with those younger than 60 paying full price. These are coordinated by the county Senior Nutrition Office and include congregate or group meals that are available at many county senior and community centers, with some of those meals targeted to specific ethnic groups, as well as Meals on Wheels, which provide home-delivered meals to seniors with medical or health issues that prevent them from attending a congregate meals site. Along with these government programs, there are many local nonprofits that provide food assistance to Montgomery County residents, and there are many more so now in response to COVID. The largest of these providers are food banks, and they include Manna Food Center and the Capital Area Food Bank. These organizations provide food assistance to individuals, but also provide resources to other smaller food pantries in the county to help them serve their clients. Next, there are local food assistance organizations such as pantries at local houses of worship and other community organizations that provide food assistance using a variety of distribution methods. Some providers operate what is called a choice pantry, meaning that clients are able to choose the foods they take home, much as they would when they shop in a supermarket. Some providers are pre-packing bags and boxes that they then distribute at drive-through and walk-up distributions, either at their sites or in satellite locations in apartment building or school parking lots. And finally, some are able to make deliveries to those unable to leave their homes due to illness, quarantine status, or a lack of transportation. It is worth mentioning that the great amount of resources made available through federal, state, and local grants during COVID to respond to these high rates of food insecurity have helped further pre-COVID goals within the food security community to provide fresh produce and culturally appropriate foods to county residents whenever possible. Susan mentioned new initiatives like Manna's Farm to Food Bank program that have supported Montgomery County farmers while providing fresh, desired produce to many food insecure county households. Other food assistance providers like AfriThrive have used grant funds to start their own gardens to grow crops preferred by foreign-born residents from African countries that are not easily available to source in the county. And I should also mention, because I saw Jenny Freeman on the call from Community Farm Share, there are also organizations that are providing seasonal farm shares to families in need. And finally, a number of other providers are forming partnerships with local farmers to either purchase or accept donations of locally grown produce. And last but not least, in response to COVID-19, the County Department of Health and Human Services has partnered with community-based organizations to create what are called COVID-19 service consolidation hubs. Take the next slide, please. And these hubs are located at 8 sites across the county, and they coordinate a number of services, including food distribution, diapers and some baby needs, home delivered meals and basic necessities for COVID affected households, and those facing emergency or transportation barriers. And they also provide case management and serve as a connection point with other resources and needed services. And I'm going to turn things over now to Elizabeth to share how you can locate some of these many different county organizations and resources.
Thank you, Anne Marie. If you could go to the next slide, Susan. So now that we have learned all of the many ways that the county is addressing food insecurity, I'm here to answer the question, how do you get in touch with these resources? And we wanted to first note that we will be providing all of these slides in a follow-up email. There are a lot of live links in these slides, so these slides themselves are a great resource for you in order to reach a lot of the information that we're talking about today. And I am going to try to blow quickly through this because I do see a lot of great questions in the chat box as well. So we want to be able to leave a little bit of time for that. I will say briefly that the county's website is a fantastic resource for a lot of these food resources. We have a link there to the website. They do have links to a lot of the SNAP application assistance programs, information about the service consolidation hubs that Anne-Marie just mentioned, as well as information about their food access call center. We have a link here to their online request form, and this is a center that was set up during COVID to respond to food issues that came up through the 311 information call center. We do have a Shannon Fernandez here on the call. Shannon, we're running a little short of time. I was going to have you say a few words, but we do need to blow through this. But we are very pleased to have Shannon on board at the county to man this this food access call center. And so know that you have a warm body there. If you have questions about how to access these resources, you can call and she will respond. Could you go to the next slide, please? The other quick thing I wanted to mention about the county's website is they do have this food event giveaway calendar. These are resources. If you are a case manager, if you have somebody right in front of you who needs emergency food right away, this is one of the first places we suggest you go. It lists all of the pop-up distribution sites that are going on in the county. It provides you all of the information about how to access those distributions. If you are a food assistance provider, you can upload this information yourself onto the calendar, but also you can come to us for assistance with that as well. So know that this calendar is one way of getting sort of up-to-date information. Next slide, please. And then our other favorite tool is something that the Food Council developed itself. It is an interactive food assistance resource map that was developed as part of the food security plan in 2017, but is also something that we update recently on an ongoing basis rather, and rather recently went through a very diligent process of making sure this information was up to date. So this is a database that contains more than 100 food assistance providers in the county with very specific information about how to contact them, their hours, the kind of food assistance they're providing, often what kinds of clients they're serving. And you can see from the slide here that there are ways to search for very specific information. If you have a zip code, you can put that in and it will pull up organizations around that zip code. If you have a keyword you need to look for, if you're looking for delivery, if you're looking for fresh produce, these are keywords that you can enter and have those organizations pulled up for you. You can see here, I just typed in the word Muslim. If you can kind of remember that you saw some Muslim organization, you'll see a little drop down box there and it will show you all of those organizations with that word in the title. We do recommend using quotes. If you have a certain organization in mind, that is the best way to find them. And also note that if you are a food assistance provider and want to be on our map and are not, or if you run into any issues, because as much as we try to update this information, things happen to change quickly, please contact us and let us know. Cynthia is the one responsible for all of this. She put her email in the chat box, but we will do that again if you have any questions there. If you want to go through the next slide, the next is just two quick resources that we developed through the Food Council. One is a list of a number of different resources that are not food related, but are organizations that help individuals with other needs who may also be food insecure: housing, mental illness, immigration services. These are all resources that we collected through the course of our food security community calls, which the Food Council has on a biweekly basis. These are calls that in which the food assistance community gathers to hear information from government officials or experts and share highlights of their own work. just a little plug, these take place every other Monday from 1 to 2. Our next call is actually October 12th, Tuesday, to take into consideration the holiday. And we will be discussing gardening issues there and ways in which food assistance providers can grow their own food to serve our food insecure community members. The other resource that's on there is a list of different organizations outside of the county. We get a lot of individuals from outside the county coming in, and while no food assistance provider wants to turn these people away, we are sensitive to the fact that there are some government programs that can only serve our Montgomery County residents. So we have come up with this list that hits all of the counties that border Montgomery County and provides some closer to home resources for those individuals. Go to the next slide, please. We just want to put in a quick plug as we're wrapping up sort of the presentation part of this program today. If you are interested in joining our Food Recovery and Access Working Group, this is an email listserv that provides you with information about all of the food security initiatives going on at the Food Council. This includes updates about our community call, policy updates, grant opportunities, where you might be able to find food, and also our newsletter. Every other week, we do a food security specific newsletter. So be on the lookout for that. And as I mentioned before, our bi-weekly food security community calls are listed there as well. They do require advanced registration, and the link for that is available as well. So I'm seeing lots of questions here. I'm going to pop that over to Anne Marie to moderate any questions that you may all have.
Sure. The last one that I just saw come into the chat that I was starting to respond to was about resources that are available for food insecure community members that lack access to transportation, especially public. This is one of these things that is great information that we provide in our food assistance resource map. Because it will be included there if the food assistance provider provides delivery services, that will be noted there. So I would start with that as your first source for looking up providers that can deliver items. I have been watching the chat. I think everything that has come up as a question in the chat has been answered, or at least some email addresses shared for specific questions. If I'm wrong, please do not hesitate to either raise your hand or to put it again in the chat, but I'm scrolling through now for participants to see any hands raised. Oh, I see one. Goldman, let me unmute.
Yes, hi.
Yeah,
Sorry,
hi.
I apologize if the response was in the chat and I didn't see it. Two quick questions. One, can SNAP and WIC coexist? Can one family have both, count with both benefits? And the second was, I think someone asked a question about the PEBT. Is there an update on that? I'm sorry if I missed that response. I know the question was also in the chat.
Okay, Allison, did you want to take those?
Yeah, I could take those. Yes, you can have both SNAP and WIC benefits. And for pandemic EBT, as far as I understand it, it is only applicable now that kids are back at school and they're getting meals at school. It is only, benefits are only awarded if you, if the school is closed or if you don't have access to a school that is open. But I was messaging back and forth with Cassie Cardona about it. And I think that if you have any specific families that have questions, they should reach out to the DHS call center because they handle all benefits questions. So if you have families that believe that they should have gotten some benefits, that would be the best place to go.
Thank you.
Okay, and I did see another hand up. Where did that go? Oh, is she not on? I thought it was.
I think the name of Goldman.
No, that's who, yeah, that who was just asked. Okay.
Anne-Marie, if you're while you're doing that, Susan, if you could just throw up those slides again, maybe that one last slide. The question about transportation was a great one, and it really touches on a lot of the issues that we deal with here in terms of sort of the many upstream issues that combine with food insecurity to make life so difficult for folks who fall under the poverty level. And one of the things that we are doing here is offering some training. See, my screen just went blank. 1 second.
Would it help if I read them out, Elizabeth?
I got it. Sorry about that, folks. There's a little technical difficulty. So we do have some training opportunities coming up, and one that we're really excited about is called Transforming Food Systems Through Advocacy, Community Leadership, and Policy Change. So this is an opportunity for folks to get involved in food policy issues at a local and county and state level. So this is a two-part series, and it's geared towards nonprofits and community partners to provide you with real strategies for engaging elected officials. I'm just reminded of the transportation issue as one that is something that we always are mindful of in helping to connect our food insecure community members with resources. That is one of the biggest barriers that we often hear they face. So just throwing this up there as a future learning opportunity if you want to get engaged in some of these kinds of issues. We will be offering other virtual training series that are more related to food assistance provision in the county. Our next one is going to be on November 4th, and it's a Fresh Produce 101. You heard Anne-Marie talk about all of the amazing efforts there are in getting fresh produce to people in need, because this is one of the most requested items that we hear from our clients visiting food distribution sites. And so this training will provide you with sort of a life cycle of how fresh produce gets to people, how it is sourced, how you handle it and safely, and how you can optimize federal benefits to use to reach fresh produce needs. So we just wanted to throw those two options out there as well.
I will also mention, I will share in the chat, the Department of Transportation is currently conducting a survey to get information on public transport, specifically on the ride-on bus. So that is something that if you have feedback on, in the areas and with the families that you work with, it would definitely be great to capture that information and submit them as comments. So I will try to dig that up quick and share the link. I do see in the chat, Yukio asked if we have a street fair that MoCo sponsors. We do not. I will say, though, that many of the service hubs that we refer to do outreach events within the community, or if something is going on locally, they are likely to have a table out there to promote their services to the surrounding area. So I would look out, if you go to the county's website, the 311 that Elizabeth had mentioned, and you search for the locations of the consolidation hubs, you can find more information about their activities there. Cassie had asked in the chat if apartment complexes are willing to partner with the Food Council for complex-based distribution, as was done more frequently when things were more on lockdown. I will just stress that that was not the Food Council that was hosting those food distribution events. Those were food assistance providers. So many of those, as far as I know, some of those are still happening. Others may have had to have cut back as funding or resources, went away after initial rounds of federal and state and local grants. But either families should be referred to the hub in their area, or again, you can use our food assistance resource map to locate a provider nearest them that might have, either be close by or has a site that they do drop off at.
Thank you, Anne-Marie. I'm looking at the clock, and we've almost reached the end of our hour with you all. I did want to thank all of my fellow food security team members for putting this program together, and of course, all of you for joining us today and being and participating in all of this. So many great questions. Be on the lookout for more trainings. We'd love to hear ideas from you as well. If there are areas of interest that you are looking to learn about, please let us know, because this is a two-way communication stream here. The last thing we wanted to do before we let everyone go today is that we did want to start a evaluation survey. We do ask this of all of our participants. It's a quick survey, 6 questions. It just asks basically how you came to find us and what you thought of our program today. And again, any other questions or suggestions you have, place them in the chat box, and we will be following up in the next day or so with the recording of this presentation, the slides, and any questions we didn't get to today, we're happy to answer there as well. So thanks again to all of you for joining us. Does anyone else have anything to add?
Great job, Elizabeth. I just wanted to say thank you again to everyone for coming today. And thank you so much to those who are filling out the poll. We look at your feedback very closely, and we use this information to help with planning moving forward. So please let us know what you thought of today's training. And if you have other more qualitative feedback you want to give, if you want to share something in the chat, if there's a topic you would like to hear featured in future trainings, feel free to note that in the chat box. We also review that very carefully, as you see, during trainings and following. So please feel free to share your feedback with us, and thank you. Thank you so much. I'm going to keep the poll open for a few more minutes. Cynthia, in just a moment, I will share the results with you as well for documenting. Thank you. Thank you all so much for joining us today. I see we're at noon. We want to always be respectful of everybody's time. So officially, our training is complete today, but I, at least, and I think 1 or 2 of my colleagues are available to stay for a few minutes. If anyone has lingering questions, feel free to stay or email us. I know contact information has been shared in the chat. And as Elizabeth noted, we will also share today's slides in a thank you note with all of you as well. So we will be in touch, and thank you all so very much for joining us today. And I hope everyone has a lovely afternoon. Thank you.
I'm going to take advantage of the quiet to say hello to Mrs. Burke, who's the PCC at my child's school.
Thank you so much. Thank you. I did actually have a question. I wanted to know, and obviously this was for the COVID Recovery Fund. We were so confused as far as who exactly led that program, if parents had questions. And is there a difference as far as how much funds, like let's say, for example, if we had a family that are enrolled in SNAP, is there a difference as far as what the recovery funds that they were going to get? And I guess if they're still enrolled in SNAP, because some of the families were confused if they were going to get additional funds if they were enrolled in SNAP. Am I making sense?
I'm not sure what you mean by recovery funds. Is that pandemic?
Yeah, the EBT, right, funds that were deposited. Some families were confused. You know, they were saying, well, I didn't receive the funds. And I was under the assumption that if they were already enrolled in the SNAP, that part of that funds were already included in their EBT. Like, am I making sense? I was just
that makes sense. I got you. Yeah.
Okay,
So if they had school-age children who would have been receiving, meals in school, then they were supposed to get extra SNAP benefits as part of their monthly SNAP allotment. So they should have seen that. It wasn't. I don't believe it was a separate thing. I believe only new EBT cards were sent to families who were not previously enrolled in SNAP for the children. But if the family was already enrolled, I believe it was loaded right on to the EBT card.
Okay. Thank you. And I think I don't know if I think you guys addressed it, because I do have families that are coming from other county that are enrolled in the SNAP, but do they need to reapply, or, because a lot of times I'm helping these families apply for these programs.
Sure. If they are coming from Maryland, I don't believe they need to reapply because it's all a Maryland, SNAP system.
That's
But
what I thought.
they would definitely need to update their information.
Yes.
Yeah. So in doing that, I think if there was anything that DHS needed, they would then contact the family. But I think that all they should need to do is update their information, and then any updates to income or anything like that.
Okay. Yeah, that's it. Thank you so much. This was awesome. Thank you so much. And then as far as the follow-up with all the slides, it's just going to, I'm assuming, be emailed to all of us?
Anyone who registered, yep, we will send
Okay.
it to you, and then you're welcome to send it on to any of your colleagues or anyone you think might find it interesting.
Oh, okay. All right. Thank you so much, ladies. This was awesome. Have a great day.
Thank you.
Thank you. Thanks for joining.